Well, I'm going to turn the mic over to Donna McDuffie, another fellow planner from the Minnesota Department of Health.
Good morning, everyone. It's my pleasure to introduce the Commissioner of the Department of Health, Dr. Ed Ehlinger. You'll find his bio on page 16 of your program, if you'd like to take a look at it. There it says that he directs the work of the Health Department, and the Health Department is responsible for protecting, maintaining, and improving the health of all Minnesotans. What it doesn't convey is his commitment to that little word, all. Whether the Commissioner is in Waite Park walking with city leaders on their healthy living trail, or in Marshall on a bike tour with decision makers. He might be in front of state lawmakers, or in the bright lights of the media cameras, or even when he's at a distant conference writing a letter to the MDH staff, he's always driving home the importance of that word, all. He said, and I quote, "All of us have some responsibility to the health of our community." He also said, "My number one priority is to do whatever will best protect all Minnesotans from exposure to this disease," in reference to the Ebola crisis. He's urged legislatures to conduct health impact assessments for all major policy proposals. And my favorite, he said, "Health is really not just about medical care and personal choices. It's about us, together, creating the conditions in which all people can be healthy." All is the essence of equity. It is at the heart of everything our health commissioner does. Won't you all please give him a warm welcome, Dr. Ed Ehlinger.
Good morning, everyone, and what a nice, thank you for that wonderful introduction, but it was also nice just coming into the room and feeling the energy and the excitement that's in this room. It is obvious that we have a lot of people who are energized about food, food access, food equity, and all of the things that go into that. So thank you for being here. Thank you for all of the work that you're doing. And this is not, and just one thing, you cannot catch Ebola through your food. And I'm so glad I get to talk about something else. And it's other than, and it was a great choice of today. You know, yesterday was National Chocolate Day. And tomorrow is National Candy Corn Day. Because of this conference, today is National Oatmeal Day. Very healthy. And today is also the feast of St. Thomas Balachi, who's the patron saint of butchers. So we've got our grains and we've got our protein and we got our meat, so we've got it here. So good day to have this. Well, I'm going to start out back when I was in high school. I read this little book. It's called The Other America. It was written by Michael Harrington. And he said in this book, let me quote, "There is a familiar America. It is celebrated in speeches and advertised on television and in the magazines. It has the highest mass standard of living the world has ever known. But there is another America. In it dwells somewhere between 40 and 50 million people. They are poor. To be sure, the other America is not impoverished in the same sense as those poor nations where millions cling to hunger as a defense against starvation. This country has escaped such extremes. That does not change the fact that tens of millions of Americans are at this very moment maimed in body and spirit, existing at a level beneath those necessary for human decency. If these people are not starving, they are hungry, and sometimes fat with hunger, for that is what cheap foods do." That was written in 1962, and sadly, many of the things that Michael Harrington wrote back in the 60s are really still true today. So that's why we at the Minnesota Department of Health are really looking at how to address some of the issues that were raised in The Other America, how we can make sure that all Minnesotans have the opportunity to be healthy. And we start by asking the question, what creates health? You know, it is much more than just medical care and personal choices. It's not just the absence of disease, but a state of complete and physical and social well-being. And as the World Health Organization has said, the prerequisites for health are peace, shelter, education, income, stable ecosystems, sustainable resources, healthcare, and food as one of those prerequisites for health, one of those social determinants of health. And that's why the Minnesota Food Charter, which we're going to be launching today, it's so important. That food charter is one of the things that is essential if we are going to create health in Minnesota. It is one of those social determinants. And the food charter is a roadmap designed to guide policymakers and community leaders, providing all Minnesotans with equal access to affordable, safe, and healthy food, regardless of where they live, play, work, or pray. And we are striving for access that improves the health and well-being of residents. And not surprisingly, it also has the potential to improve the state's economy. This charter marries two of the things that Minnesota has excelled and innovated in, food and health. So I have no doubt that if any state in the nation can achieve the goal of a prosperous, economically vital food system that also promotes health and affordability for food, it is Minnesota, and it is all of you, actually, who are going to make that happen. And that's why health is sort of in the middle of a lot of these conversations, where in other states it may not be the fact that we're looking at this as health. And health and diet are really key factors, certainly in the health challenges that Minnesota faces. 60% of the deaths in Minnesota are from diet-related illnesses like stroke, cancer, diabetes, and heart disease. 2 out of 3 Minnesotans are overweight or obese. And it's been estimated that Minnesota has obesity-related healthcare costs over $2 billion each year. That's sort of on the excess side. On the hunger side, we know the importance of good nutrition to infant health and good infant and child development. We are also learning more about the health consequences of toxic stress and other physical effects of poverty and food insecurity. 3.5 million visits to food shelves, more than twice the number of visits to food shelves that we had 13 years ago. 20% of families with children in Minnesota face hunger and food insecurity. We're knowing that early stage in life, those insecurities cause lots of stress that we bear the consequences many years down the road. In recent decades, diet-related health issues such as obesity, diabetes, and heart disease have surged and presently present long-term challenges to Minnesota's prosperity. Changes in the way Minnesotans eat, particularly high-calorie, unhealthy foods and beverage, contribute to the growing healthcare costs and lower productivity. That's not sustainable in this state if we are going to remain one of the healthiest states in the country. As for the solution to these problems that you are very well aware of, probably more so than I, the key component is certainly encouraging individuals to make healthy eating choices through various kinds of support and education. But we found out through our Advancing Health Equity report that too often people don't really have a choice. Yes, we can encourage them to be healthy, but if you don't have healthy choices available to you, it's really a false choice. It is a non-choice. So as a state, we must work to make healthy and nutritious food choices not only the easy choice, but actually a possible choice. And we can only do that by putting health and health equity at the center of all of the policies and systems that we do. So in your magazine, in your book, your little booklet that you have with the health charter, there are a bunch of policy suggestions. I want you to look at those with one frame particularly. Look at each one of those recommendations through the lens of health equity. And that'll change how you think about the problem. And if we're going to be a healthy state, we need to reduce the disparities, and we really have to advance health equity. And this is as good a place as any to start, since food is one of those essential contributors to health. So Minnesotans often face barriers to getting healthy, affordable food. And in the context of equity, we know that these barriers are greater for Minnesotans of color and American Indians. And Minnesota Department of Health is focused on ensuring all Minnesotans have the opportunity to be healthy. And nothing is more foundational to that effort than ensuring equal access to healthy food, regardless of race, place, or income. And we know this can be done because we've been making strides through our statewide health improvement program, or SHIP, for several years. From gardens to farmers markets to worksite wellness and farm to school programs, This national model, this pioneering policy and systems change approach at the community level, with community leaders making it happen, is helping to stem the tide of obesity and the chronic related diseases. We've actually started to turn the curve on obesity through the SHIP program and others, things like breastfeeding. We also know that this work can happen only with partners from agriculture, business, transportation, government, and education come together. After all, we at the Minnesota Department of Health, we don't grow food, we don't sell food. Our role is to really bring people together to achieve the goals of the food charter. Being interviewed is what's unique about this. Health is really what all of us do collectively to assure the conditions in which people can be healthy. You're here collectively from all different sectors of our state, all different parts of our state, to find out ways that we can work collaboratively, collectively to assure the conditions around food, around availability, accessibility, affordability, around safety, and food skills. Those are some of the conditions that are needed. So I'm optimistic that this food charter will help guide and add momentum to our ongoing efforts at the state level, along with my fellow commissioners, some of you who you will hear today or over the next day or two. And so for the past several years, the Minnesota Department of Health has partnered with the Department of Agriculture and Human Services, DEED, as well as other funders and institutions to support healthy food access in our food and farm economies. The charter that you're going to have today provides us with a shared agenda, an agenda for creating a healthy population and a vibrant food and farm economy. So I am pleased to be the one to kind of kick off this by this partnership and present to you the Minnesota Food Charter, which is on your table, and you each have a copy of the document. And you'll learn this morning about the charter. You'll learn about the website, the people, and the shared agenda, and the power of working together to create a healthy food future for all Minnesotans. In making this charter a possibility required all of you, required many people throughout the state putting their input, sharing their ideas, coming forward to be part of this. But I have to have a special thanks to our partners at Blue Cross and Blue Shield, who along with the Minnesota Department of Health provided some funding and support for this effort, and also to the 2,500 people from across Minnesota and from all parts of the food system who participated and came together to create this charter, which is truly the people's vision for a food system that you want, that everybody in the state wants. So we've got now a 5-minute video that you're going to watch, and then I will turn the podium over to Dr. Mindy Kurzer, the Minnesota Food Charter Steering Committee Chair and University of Minnesota Professor in Nutrition Science. Thank you very much and have a great conference, and let's kick off this charter in a huge way. Thank you very much.
The land, the people, the traditions, the food. For those of us who call Minnesota home, there are many reasons to love this state of ours, and one characteristic of our state is our ability to come together to solve problems. Yet a challenge that continues to confront us is access to safe, affordable, healthy food for all Minnesotans. Today, the cheapest foods are often the highest in calories and the least nutritious. For all Minnesotans, and even more so for Minnesota's low-income families, healthy food may not be affordable or even available, and many rural residents need to travel miles to purchase fruits, vegetables, and other healthy foods. The consequences of these challenges to healthy food access are real. This means many of us struggle in our day-to-day lives, at school, work, home, and in our community. Over time, a lack of access to affordable, safe, and healthy food leads to chronic diseases like diabetes, heart disease, and certain cancers. And while many farmers and food-related companies want to grow and prepare healthy foods, there are many barriers that need our attention. The truth is, our economy, where our food comes from and how we get it, as well as our personal health, are all interconnected. Now we're proud to introduce the Minnesota Food Charter, a document that guides you in making healthy food available to more people. The Charter will offer healthy food policy and system solutions to improve access to healthy food in our schools, child care centers, workplaces, health care providers, hunger relief programs, communities, and stores. Anywhere food is produced, processed, distributed, and enjoyed.
Despite the fact that we have lots of agencies and lots of organizations working on food issues, we still have a lot of people who are not getting access to safe and healthy food. What the Food Charter does is take all of these efforts and synthesize them in a way that people can understand. It helps to get organized the efforts of all of these multiple agencies. This is going to make the efforts a lot more effective of everybody working in the nutrition and food distribution systems.
The Minnesota Food Charter is a result of hundreds of listening sessions, online town forums, as well as interviews with a diverse, very, very broad group of people, thousands of people across the state.
Food is such an incredible part of us, obviously, just ingesting it, but it's a part of our society, connected to our energy use, connected to our society, I think, in ways that sometimes we don't suspect or understand. And the Food Charter, I think, is a way for me and for, I hope, all of us to look more critically and carefully at food and its interrelationship with our lives.
As a leader in government, local government, many times we're not even thinking about that there's a potential for us to improve the food systems, whether it's a transportation system or the pathways, walking pathways, bike pathways, all those things, if enhancing them and making sure people can get to the food sources.
Many of the reservations, they have similar transportation issues. The grocery stores are small. They're convenience stores. They have a lot of prepackaged processed foods. And while it's convenient, it's not always the best food for you. And that came out in the Minnesota Food Charter. So it looks at how do you impact that and make healthier choices in your community to increase access to better foods.
In North Minneapolis in particular, we have on one of our main corridors 37 unhealthy places to get food and one grocery store. So access is a huge issue. I believe wholeheartedly that if people had healthier options and increase in the number of healthy options, that they would make better choices.
Community members can begin to see that, oh, I've been trying to increase food access from purely a anti-poverty perspective. And then you'll begin to recognize that others are suggesting the same thing from a health perspective or from even a transportation perspective. And that we've been working in silos and we need to see the commonalities and leverage those common benefits.
I think it was really interesting with the Food Charter how all the different perspectives of people seeing a little piece of the food supply from their own perspective worked. And it's really a wonderful document because it brings all that input from all those perspectives together with a real understanding of the food supply.
The Minnesota Food Charter will help us leave a legacy of healthy food access for future generations and make Minnesota a more prosperous place for all. Explore the Minnesota Food Charter at mnfoodcharter.com. Find out what you can do and go make it happen. One person, one organization at a time, we can make a difference.